welcome to Being Patient Brain Talks. I'm Deborah Kan, founder of Being Patient. Today we're doing something a little bit crazy. We're streaming live to all of our platforms on YouTube, LinkedIn, Facebook, and Instagram. So fingers crossed it goes okay. Today we're going to talk about a topic that's near and dear to my heart. As the mom of an athlete, I have a son who played rugby in college. It was always a very nervous topic for me because I was always worried about concussion and what the implications were for him to play such a high contact sport. So today we thought we would get one of the experts in to tell us about where is the latest research on repeated concussion, traumatic brain injury, and the implications of the future. So joining me today is Dr. Munro Cullum. He's coming to us from the University of Texas Southwestern Medical Center. He's an expert neurologist on this topic, and he joins us now. So welcome, Dr. Cullum. Thank you so much for being here.
Thank you very much. Actually, I'm a neuropsychologist, but that's okay.
I beg your pardon. You are a neuropsychologist. Okay, let's talk first about, I want to talk a little bit about childhood. Let's start there because I have interviewed neurologists who say, you know, they had sons who played football, they were big football fans, and now they regret that. And knowing what we know today, they would really have reconsidered putting a child in a high contact sport. So my question is, you know, should we be letting kids play games like football today?
Well, along with a lot of other parents are asking that similar questions, obviously. Of course, there are always pros and cons to any activity, and certainly football is one example, is one of those higher risk for concussion, brain injury. But there are many, many benefits, obviously, to it as well. I think there's many, many factors that parents have to go through and consider. Is the child ready for the sport at whatever age that they're considering? Are they, and I mean that by physically as well as psychologically. If little Joey's a 250 pounder in sixth grade and he's aggressive, that he might be a danger out there to other kids. And likewise, if little Joey Jr. is 60 pounds, fully padded up and everything, he might get squashed out there. So, but then the psychology of it comes into play. Also, the safety and the attitude of the coaches and trainers when there are trainers involved. Obviously, parents need to make sure that their kids are going to be in as safe an environment with as safe as an attitude possible toward the sport, i.e., safe tackling techniques. How do you fall? How do you hit? How do you take a hit to make it as safe as possible? We're learning more and more about repetitive head hits, as you mentioned. And the good news, not to cut to the chase fully, but is that most people after concussion turn out just fine, even later in life.
So is it the type of hit that you get that's more dangerous, or is it the repeated hit? I mean, I've been told, that my same son played soccer for many, many years. And I remember watching the ball come from like way down the field and then he'd head it and I'd be like, no, don't head the ball. Is it possible that repeated hits like heading the ball in soccer can lead to really impairment down the road?
Well, there's a difference between just general hits to the head and those intentional headers like you're describing. In fact, the literature suggests that the headers, when intentional, obviously, I guess by definition they are, they don't tend to cause much in the way of cognitive impairment or brain injury per se. We think that's because in the right position, using the right angle, the neck musculature, the head angle, if it's done properly, those don't seem to be as strongly associated with concussion, for example, than if you get hit blindside with a force or something that you're not expecting. So I think there are differences there. There is mixed literature in this area in general, though. You can find some studies that report no significant differences in kids that head the ball a lot versus those that don't, and others have found some minor imaging differences in some of the smaller studies. But overall, there doesn't seem to be a huge long-term risk for people doing soccer headers. Now, the studies that have shown an effect have really looked at the highest percentile people that are like heading the ball with big hits a lot. And there may be some greater risk for those people. However, there are other factors involved with that too, beyond just the headers. Those tend to be the more aggressive players, and a variety of other factors go along with that.
So blinds, you mentioned blindsided, that just kind of like that hit completely unexpected. Do we know what type of injury is most detrimental in the end, or which causes the most damage? Are there, I mean, this sounds really stupid saying this, but are there some concussions that are better than others?
Well, a concussion is a concussion. We have learned that the rotational injuries are the ones that tend to produce or be more strongly associated with concussion symptoms. So if you get hit from the side and the brain is twisted as well as shaken, those tend to result in more concussion symptoms than, for example, a head-on direct linear hit. So those are some of the ones to watch out for. However, in terms of the long run, again, most people turn out fine after concussions. So we don't know enough about the injury really to determine who might be at risk for these sort of persistent symptoms.
Okay, and what about those? Like, we have a lot of people in our community who have had really traumatic brain injury, car accidents, that type of injury, and really feel like they have not recuperated. What do we know about, really bad traumatic brain injury and the potential for it to lead to CTE or dementia?
Sure, and that's a great question. Of course, traumatic brain injury is on a continuum. At the mild end, we call it concussion. Concussion is the same terminology as mild traumatic brain injury, and that goes all the way up to severe traumatic brain injury, in which case there's extended loss of consciousness and much greater symptoms at the time, as well as much poorer recovery and a greater risk for dementia later in life. In fact, the links between head injury and dementia have been most strongly supported by the literature on the more severe traumatic brain injury end of the spectrum.
So this might be a good time to ask, kind of like merging those two topics. One of my son's friends, I spoke to him the other day, and he said, he was a football player who went to rugby, and so he always got concussions, and he was always pushed back into the game, which was very common until recent years, where there's been a lot more attention around protocol in sports with concussion. So, he said, several years ago, he got a really bad concussion, went back in, continued playing, thought he was fine, and then his vision started to change. Everything looked warped. What is that signaling inside the brain? Was his question to me. And I was like, I have no idea. But now that I have you, I'm asking that question.
Well, well, just like brain injury occurs on a continuum, so do concussion symptoms, and they can range from really very mild and very minor to quite distressing, such as significant visual disturbance. You'll see some people after a bad concussion be rendered unconscious. Others may show what we call the posturing reflex when there's abnormal motor movements, which can be really distressing for people to see and view, although their outcomes don't really look different than people that have lesser injuries, if you will. But there's a host of symptoms that can occur. When we start getting worried about repetitive concussions is when the recovery time for each subsequent injury is getting longer and longer. those are the ones we're most concerned about. And that's when we start thinking about, wow, it's like the age-old question, how many is too many? And I thought you might ask that question, and the answer to that is we really don't know. Now, I have heard a variety of physicians say no more than X number, and that's really that's conjecture. We really don't have data, and especially no two brains are alike. So if there are folks in the audience that have done brain anatomy studies and looked at actual human brains, the great paintings and pictures we see in all the medical textbooks are terrific. Here's this lobe, here's this sulcus, this crevice in the brain. Here's the name of the lobe, and here's where here's the perimeters of it. In an actual human brain, some of those things are actually hard to find. And our brains look a little bit different, even though there's similarities. But no two brains are alike physiologically as well. So a force that might produce concussion symptoms in one individual may not produce those symptoms in the individual beside them, even given the same exact injury.
Right.
It's really quite variable, as are the symptoms. The saying in the field is if you've seen one concussion, you've seen one concussion, because I mean, certain symptoms are more common than others, but we really start to get worried when the symptoms last longer and or are worse or a greater magnitude.
What is happening exactly inside the brain? Take us from concussion and to the point where you would get worried. Like we've now passed that, like, oh, it's just a concussion and something else is going on inside the brain due to repeated hits. What does that look like inside the brain?
Well, that's a complicated question. At the time of injury, the time of a concussion, many things are happening in the brain. If you were to look at a fresh human brain, they're kind of like thick jello, basically. So within the skull, when there's an impact or a rapid acceleration, deceleration force, the brain actually does slosh about and back and forth a bit, and it can come into contact with the skull. It's protected by some other protective layers, but in essence, the brain can become bruised by bouncing back and forth. And I mentioned earlier with concussion, the rotational injury, the major part of the brain, the cortex, really kind of sits on top of the brain stem, if you will. And the cortex is large, so it can actually move a bit on top of that brain stem. And when you get a disruption of the uh, ascending and descending fibers within that core brain region, that is what can really disrupt consciousness and produce either full-on loss of consciousness or just maybe a brief feeling dazed and whatnot, some of those momentary symptoms. Um, Physiologically, I mean, there are all sorts of cellular processes going on with abnormalities in energy. So the brain gets to, the cells of the brain are become kind of starved for energy in that moment at a time when the brain's not creating a lot of new energy. So it's a pathological process of the cells needing nutrients, nutrition that they're not getting at that moment. And that can cause this physiological disruption we think are related to a variety of the symptoms. Now, that is a temporary process. So when you go from there to what happens years or decades later, that's where we have more research to do. We think that inflammation in the brain may be a driver of longer term pathologies or potential risks for dementia in certain individuals. Um, Although, as noted, the vast majority of people do not have any complications and are fine later in life after concussion. That's the majority. Persisting symptoms is something our research group and others are looking at all across the country because there is a subset of anywhere from 10 to 20% or so of people that do continue to report and experience some unusual symptoms that last beyond the typical recovery window.
What are some of those symptoms?
Oh gosh, they really vary a lot. Some people just feel off a little bit. They feel like they have what they describe as kind of a brain fog. Maybe they feel like their reaction times are slow, their thinking is slowed down. Some people develop irritability, anxiety, depression symptoms can also be a part of this complex um, symptom constellation, if you will. It used to be called post-concussion syndrome. We've really moved away from that term per se because it's really not all that useful. Um, there are also there's a lot of interest in the field of exploring what factors may be both protective against persisting symptoms and what factors may drive those symptoms. For example, pre-existing psychological factors actually seem to play some role in some of these persistent symptom cases as well. It might be a component of anxiety that's helping to drive some of it. And we don't fully understand that yet. And again, some of the data we're looking at are group data, which obviously it's hard to predict in individual cases. So the the good news and bad news, there's more to learn at this point, and right now we really don't know who's at risk for those problems that don't go away. We're doing one study looking at autonomic nervous system function as well as psychological family of origin factors, sociodemographic factors, trying to essentially develop algorithms, if you will, that will help us at that time one initial clinic presentation, help us identify who might be at least in the higher risk category for having those persistent symptoms.
Let's take the football players as an example because it seems like a lot of them have ended up with CTE. Or I don't know if I can say a lot. I don't have that data, but you hear about cases of professional footballers who now have either passed away or who have CTE in the brain. Now, tell me a little bit about what we know about CTE. I have been told that you go right to tau. Tau is a big biomarker for CTE. Just for our audience who might not know, the pathology for a neurodegenerative disease like Alzheimer's is usually like beta amyloid plaques, tau inflammation, whereas in comparison, a dementia that's caused by traumatic brain injury, CTE, is more you see the presence of tau earlier on. Is that true, Dr. Cullum?
Well, you put a whole bunch of variables into that question.
Too many.
Um, as far as CTE, it is primarily based on the presence of abnormally phosphorylated tau accumulation in the brain in characteristic patterns. They're deep in the brain sulci. Those are the folds of the brain that look different characteristically. They appear different than tau in Alzheimer's disease, for example. CTE is a very rare condition, first of all. When the pathology is detected at postmortem upon after death, and that's the only way to detect CTE right now. When it is detected, it's usually accompanied by other pathologies as well. Alzheimer's disease pathology is common in more than half of the cases with CTE pathology. A postmortem diagnosis, if you will, of CTE can also be made, according to current guidelines, on just very, very tiny amounts of the abnormally placed tau in the brain. And in fact, those cases often have other pathologies that are much more prevalent than the CTE related pathologies. So we don't actually know what, if any, symptoms are related to the CTE pathology.
So is it
And
not possible to properly diagnose CTE until postmortem?
that's correct.
Because you're
If
looking for the phosphorus tau. That's the only way to have a confirmation of CTE. Is that right?
there, there are, various postmortem studies that the neuropathologist must do, and they're not routinely done in every, autopsy, for example. They do require some special stains and analytic techniques. Um,
Right.
but yes, that can only be diagnosed with a sample of the brain. No one should be using CTE as a clinical diagnosis.
Okay, so I want to know, and this is the question that I'm asked just because we have our website that deals with the brain, and I don't know the answer to this. What is the best thing a person can do if they get a concussion? Like, what is the best road to recovery? And what should be, from your vantage point, the standard of care, the gold standard in terms of concussions and recuperating and, as they pertain to athletes?
Sure. Obviously, first and foremost is concussion awareness, concussion education, and I mean that for everybody, the athletes, the kids, the coaches, the staffs, parents also. People need to learn to identify symptoms of concussion. Secondly, when a concussion is suspected, the child or adult should be removed from play. The NFL and the NHL have great concussion protocols. Now, obviously, occasionally players go undetected in any situation, quite honestly. And athletes often don't want to report having a concussion for their fears of being removed from play and they don't want to come out. But that's where the education comes in really important. And I try to counsel, especially young athletes, that if you're not feeling okay after a hit, you need to report that to somebody. Tell your coach, tell your trainer, the assistant coach, somebody, so they can get you properly examined. The risk is really if somebody going back into play too soon before their brain is recovered and potentially sustaining another hit. During a concussion, one thing I forgot to mention earlier, the brain can swell in response to the injury, much like any other you know bodily system. And that brain swelling can get really bad if you get a repetitive concussion before the brain's recovered. There are occasional reports of so-called second impact syndrome, where people have died after repetitive concussion. It wasn't recognized appropriately. Now that's quite rare. It's not something for everybody to be, terrified of, but concussion awareness is really important. So they need to be removed from that risky activity that gave them the concussion. And then they need a little bit of rest. Oh, they should be evaluated by a healthcare professional with some experience with concussion. And then they need a little bit of rest. And by a little bit of rest, I mean maybe a day or two, quite honestly, is most common. For a while, the thing to do seemed to be you take away the cell phones, don't let them watch TV, don't let them read, put them in a dark room, just bring food to them and whatnot. And if you do that, especially with the teenage brain, you're going to have an irritable, depressed teenage brain. If you do that to them for several days, and then you're seeing evidence of what you think is the concussion, but you've induced those symptoms by the good intentioned the treatments. But so actually, what we've learned is that getting people back to their normal routine as soon as possible is really the best. In fact, light exercise after that initial day or two is a good thing. Now, what we advise is that if you do that light exercise, and light is variable for everybody because we all have different exercise levels that we're accustomed to. So it might be just a brisk walk. It might be getting on a stationary bicycle for a little while. Now, if concussion symptoms start getting worse as a result of that activity, then you just back down and don't do that the rest of that day. Give it another day, and then progressively re-engage in normal activities as symptoms progress. Early information about concussion is super important, though. Providing reassurance that you're going to get better. I mean, the course of concussion recovery is recovery, and it's a minority of people that report these kind of persisting symptoms, and so we need to encourage a positive outlook and still try to avoid and reduce the anxiety that some people might be having. I do see some people that are like, oh my gosh, I had a concussion. Now my life is ruined. I've got these symptoms. And I still have a headache 3 weeks later, and now I'm going to get dementia later on. And there's so many myths out there, so much misinformation that we try to alleviate that too. But that sort of slow, progressive return to normal activities without exacerbating symptoms is really the key now. I mean, if you think about other types of medical care, remember years ago, my mom had a hysterectomy, was in the hospital like 2 weeks, and that was the routine of care. And now they're, back out,
Same day.
surgery. Exactly, exactly. And concussion care is kind of follow along those lines, sort of.
So, before we go, I wanted to just run one thing by you because I remember a while back, I interviewed a nutritional scientist who said that boosting the brain's energy, he had a hypothesis that he wanted to apply to athletes, but, I think he was having a hard time at that time getting the funding. But, you know, glucose is normally a natural fuel for our brains, but also ketones cross the brain blood barrier. So his hypothesis was, what if we boost the energy source, like ketones, into the brain, because you can actually supplement ketones. You don't have to go to only on a ketogenic diet. You could supplement. What does that mean for recovery? I'm just wondering because I think one of the first things people do is they look for supplements that can help them. And the problem with supplements today is, a lot of them haven't been put under the scientific rigor like drugs. And so as a consumer, you're really confused what really works, what doesn't, right? Is there anything out there that people can take to really kind of restore or boost the energy that we know benefits the brain, or has it just not been properly researched?
There's not much scientific data out there for supplements in terms of concussion recovery. I've seen things that make such claims. However, it is important that patients undergo good dietary practices, good hydration, especially good hydration practices, making sure they're getting good sleep. Sleep disturbance can be a symptom of concussion as well. And yet, disturbed sleep by itself can produce disturbing symptoms as well. The kind of the fogginess and even related to headaches and things. So good sleep hygiene is really important. And then making sure they're telling parents and others about that. But good diet, good sleep, slow return to initially light exercise. All those things are good. We don't the best you know the best medicine for concussion is a little bit of rest and then slowly get things going again. And unfortunately, we don't have anything you can take that really helps speed concussion. Those studies just haven't been done.
Right. I think we're getting do we have a question coming in? Can you show me that question? I can't really see it on here. Sorry. So we have a question saying, for contact sports, do you feel EEG would be beneficial at sideline to help the diagnosis, to help diagnose the concussion and severity to keep the player safe, versus a general neuro exam? So is EEG a way that we should be diagnosing or actually adding it to standard of care to understand the severity of concussion?
Well, it's a good informed question. However, EEG really hasn't shown to add anything to that early concussion diagnosis or management at this point. There's some fancier EEG statistical data analysis procedures that can be done, and people are looking at to try to extract more unique data from EEG signals. But right now, concussion, it's a clinical diagnosis. There's not a blood test for it. There's not a physiological test for it. It is based on symptoms and symptom reporting, and also looking at the signs of concussion as well.
Right. Okay. So, last question. What do you like if you had a kid coming to you with a concussion? I take it diet, sleep. What else do you tell them? What's the kind of out of pocket recommendation here?
I tell them that they should be better within 7 to 10 days. It depends on the age. Takes a little bit longer for young kids. But yeah, the things you mentioned, good sleep, take it easy. Obviously, disengage from the activity that caused the injury or was related to the injury. You need to take it easy. We're gonna and actually, I would advise them getting checked out and getting checked out before then they also return to sport. Get that other evaluation done to see are there symptoms back to baseline, are the symptoms down, and seeing that healthcare professional with some background in concussion, have them give their actually most states require some sort of clearance before return to play anyway if we're talking about high school athletes. But try to instill a positive attitude, and then I educate them a little bit about the light exercise and the slow return to activity. And I discourage them from just becoming a complete couch potato in the process.
Okay, well, I have to say, we're ending on a good note because there's a lot of doom and gloom out there when you talk about concussion, especially when it comes to sports. So thank you so much, Dr. Munro Cullum, for joining us and really sharing your expertise. I know it's a topic a lot of people, whether you're an athlete or a mom or a dad or a coach, it's valuable to all of us. So thank you so much for your time.
Appreciate the interview time.
If you missed any of this interview, don't forget to go to beingpatient.com. Sign up for our newsletter. Our newsletter is where you hear about talks like this one. So thanks to everyone, and we will see you next time.